Good afternoon. Well, good morning if you're here on the West Coast like I am. This is Dr. David Nace, Chief Medical Officer at Innovacer, and I am so pleased to have you join for this webinar, Digital Transformation in Healthcare, Reimagining the Patient Journey Through Whole Person Care. So thanks everyone for attending, and without any ado, let's get started. So a few housekeeping details just before we get into this. We are using a platform where you can ask questions all throughout. So if you want to go into the chat function and just enter questions you have as our speakers are speaking, I will try to catch those questions as they're pertinent to the discussion and weave them into the conversation. So with that, let's go ahead and get started. First, I'd like to welcome our esteemed colleagues who are here as panelists. So first of all, Patty Padmanabhan, I'd like to welcome you. You're the founder and CEO of Demo Consulting. Pleased to have you here, Patty.
Thank you so much, David. It's a pleasure to be here.
Great. And also, we have Greg Thomas, who's the co-founder and CEO of Lucerna Health and Sanitas USA. Greg, welcome.
Thank you very much, David. Great to be here.
And we've got the whole country covered. We've got San Francisco with me, we've got Chicago with Patty, and we've got Northern Florida with Greg. So today we're covering the entire country. This is awesome. So quick overview of the agenda for today. We're going to talk about digital transformation. Like, what is that? What do we mean by digital transformation? What are some of the forces driving it? What are some of the barriers? Weave in issues around the changes we think about as a result of the pandemic, which has not only driven the concept of digital transformation, but also the importance of community and whole person care, the social determinants of health. And most importantly, we'll get into how providers can enable digital transformation. And we'll give 3 great examples of how digital transformation is occurring today in the market. So with that, let's get into it. I will note for the audience, we will have 2 polls, one around 20 minutes into this conversation and one about 40 minutes. So be prepared to answer those polls and we'll take a look at your discussions. Your feedback and your experience is so important in this conversation. So first, gentlemen, we've talked about this idea about the pandemic and we've all started doing telehealth, and it's accelerated the adoption of digital tools. But what do we mean by digital transformation in healthcare? Patty, let's start off with you.
Thank you, David. The term digital transformation means a lot of different things to different people, even within the context of healthcare. But if I were to simplify it, I would say it's about enabling online relationships with your patients, consumers, members, and caregivers, as the case may be. And what does that mean? You know, if you go back not too long ago, and I want to take an analogy here, it wasn't too long ago that if you wanted to buy something, you would go into a mall or a department store and buy whatever you wanted. Those days have changed a lot because you can shop for pretty much anything online. And healthcare is headed in that direction. Of course, not everything is going to be available online, nor can everything be done online, but a lot of things are going to be done online. One of the big areas for transformation today is how consumers and patients access their care. And a lot has changed in the past few years. And I know that is going to be the theme of much of today's discussion. So if you just look at access, patient engagement, and eventually engaging the patient through the life cycle of their relationship with a health system or a doctor, finding digital means to not only provide them with the initial access, but also engaging with them throughout their journeys. That's what the future state looks like. And the process of transforming from a predominantly in-person care model to a model where a lot of the care from access to delivery to experiences is going to be experienced digitally in combination with an in-person model. That's really what digital transformation is all about, the way I see it.
That's a great summary. You know, I have to say, I flew back yesterday from Nashville to San Francisco, and I realized my refrigerator was empty. I was on the road for 2 weeks, and I did my grocery shopping on flight and ordered, and it arrived this morning at 8 o'clock. So we're seeing digital transformation in many other industries. Healthcare is going to be interesting. Craig, how would you define digital transformation in healthcare?
Yeah, looking at the headline here and having somebody that's been in operating roles in healthcare for a long time, I would focus on two words: transformation, which, is fundamental change, not continuous improvement. So, companies and industries struggle with transformation and often fail. And then healthcare. And of all the industries, this could be the most complicated, the most fragmented, and quite frankly, unfortunately, in a lot of ways, behind in terms of consumerism or consumer mindset. And so things like experience and, focus on the consumer and support that are more natural maybe in finance industries or retail industries that are, much further ahead in this area. It makes for an interesting, almost double challenge of transformation within the healthcare setting. So, I think we're very early on in most places. It's a very long journey. If you're going to measure the effectiveness of transformation by the outcomes it drives, convenience, healthcare outcomes, satisfaction, provider satisfaction that have to now interact with more challenges than they had even before. So I think it's a great topic and a tough one.
No, absolutely. Wow, a lot of words I have never heard in healthcare as a 30-year physician. Access, we know that we've learned a lot about access. What does that mean? I thought it used to mean like I had doctor's office hours. Life cycle, experience, geez, we've all had bad experiences. We talk about that all the time with our family members and ourselves. So let's get into this. What are the actual forces, given this pandemic, given the timing of things, given things that we've talked about for years, interoperability, et cetera? What are some of the really forces driving this, and are they accelerating? Craig, let's start with you.
Yeah, I like the list here. Maybe I would add a couple things. I think there's at least three strategic trends that we track to at Lucerna Health. One is payer-provider alliances, which brings in the concept of transformation across an ecosystem. Number two, value-based care, which brings in concepts of, quality, patient satisfaction, medical cost management, operational efficiencies, because let's face it, there is the business of healthcare side of this. And in the end, transformation needs to support patients and outcomes, but also the business of healthcare. So those are two big ones there. And then of course, consumerism, more broadly thought of, just beyond digital transformation. That to me, that's more of an enabler, necessary requirement, I guess, to advancing consumerism in healthcare. And of course, that means a lot of different things to different people. And there's so many different needs, preferences, styles that, across all the consumer segments that, it's a very interesting opportunity on how the specific things that are driving this play in the overall, change that's going on in the marketplace.
So Patty, that's interesting comments. So let's break this down a little bit. Value-based care. How long have we been talking about the move to value-based care? How much of a driver is that? And will we ever move away from fee-for-service? And will we become really a consumer-driven environment in health?
Yeah, let me first talk about the consumerism part of it. And as you may know, I published a book late last year titled Healthcare Digital Transformation: How Consumerism, Technology, and Pandemic are accelerating the future. And I co-authored that with Ed Marks, who used to be the CIO of Cleveland Clinic. The notion of value-based care is in many ways tied to the notion of consumerism as well, because consumers are the ultimate demanders of value at an individual level. But there's a few other factors at play. There are macro level factors. The runaway inflation in healthcare costs in the United States is a big factor that is driving digital transformation, because digital transformation is seen as a way to reduce the overall cost of care while maintaining or improving the quality of healthcare outcomes and potentially improving the quality of the experience for both the caregiver and the patient. So if I tie it all together to consumerism, it looks a lot like what other industries have gone through. All the friction that you used to see in retailing and personal banking and securities, all of that is being slowly whittled away, if you will, through digital self-service kind of models where the decision making and the power to really influence their own outcomes is being put in the hands of consumers. And healthcare is headed in that direction as well. So part of it is going to be driven by what consumers demand. There's, of course, competitive forces at play. You've got the big tech firms like the Amazons of the world entering healthcare. And then you've got a number of nimble digital first companies that are getting into certain parts of healthcare, primary care in particular. And so you're going to see the forces of competition driving digital transformations. If you're a traditional health system and you want to compete with the digital first companies, you're going to have to transform yourself digitally to offer the same kind of service, same kind of experiences, and same kind of outcomes as any other digital first company would. So that's the second thing. And the last thing that I would mention is an internal situation within the healthcare industry. There's a huge shortage of healthcare workers at all levels of healthcare. And if you're going to get around that, you don't have a choice but to really automate and to use technology to help our current healthcare workforce accomplish more and not get burned out and not compromise on outcomes as well. So I think that's one that we don't talk about much, but it's certainly a driver for digital transformation. And it's more so now with this global crisis in supply chain for all kinds of goods and services that we're experiencing in the wake of the pandemic.
Well, so I get this whole, how do you create value and how do you engage consumers, but digital care delivery, I see that and I think about, geez, I know the pandemic, I once tried to stop ordering things from Amazon during the pandemic and I couldn't even do it, not even for a week. So Craig, what is digital care delivery? How do we think about that?
Well, I think, first of all, with not only the advancements in digital, but the advancements in science is enabling all kinds of, I think what Patty was saying is ways to make the system more productive. So for example, near real-time consults between primary care doctors and specialists with, using imaging and so forth, can really affect the costs and the convenience for the customer. So in other words, if a primary care physician can do a consult quickly to confirm, an opinion on something as opposed to referring out and starting that cycle of costs and consumption of resources, that's a big deal. And I think another change is how do we take something like telehealth, which was predominantly a low acuity convenience option for a certain segment, and use that to support ongoing care and follow up in a primary care setting, because again, that's where you have more of the healthcare issues going on that you'd like to use the technology. Same thing with remote monitoring, to be able to keep track of how a patient's doing. because turns out patients are home or at work a lot more than they are in the office, doctor's office, and just being able to be supportive, is a big deal. And then to Patty's point, I think in the end, you're still going to have all kinds of scenarios where digital is going to support in-care treatment. And you're going to have populations that will not use digital care delivery, period, for lots of different reasons. So again, I think it's a growing important part and necessary, but not sufficient for everything. And just real quick, just to add something to what Patty said earlier, this whole issue of provider shortage and burnout is huge. And right now, I think the technology and the value-based care stuff is adding to that problem as opposed to taking it away. And, primary care physicians are spending more and more of their time on, I guess you could call it paperwork or coding than, and struggling through the EMRs and so forth. So when digital transformation actually helps the provider, that's, I think that's somewhat understated in its significance in terms of potential.
Right. No, one of the audience just chipped in and talked about the differences in healthcare, as opposed to other industries where all the dynamics and regulations and compliance, like what happened to the Amazon alliance, right? Or many other people that have tried digitalizing healthcare. Google, Microsoft, Walmart, they've all tried to do it in the past. And maybe now's the time, maybe not, but we built this enterprise world for healthcare on a different chassis, technology and otherwise. Let's get into some of the barriers. Patty, what are some of the barriers we see to actually getting this transformation underway?
I'll start my response to that question, David, with a personal anecdote. And right now, I am in the process of shifting PCPs. I'm switching PCPs after 10 long years with my current PCP, and for a variety of reasons that are not pertinent. Now, the interesting thing is one of the criteria that I've laid out for engaging with a new PCP is that I should be able to do televisits from the get-go. And Craig mentioned telehealth. And so virtual consults, I take that for granted. Again, I work in the space that I work in and I have certain expectations. It's a very interesting experience that I had. I called into a new doctor's office and then I made the appointment online. And then I sent a follow-up note saying, I'd like this appointment to be a virtual visit because they do not offer virtual visits as a default. They make you sign up for an in-person appointment. And then I had to send a note saying, I am confirmed for this appointment. However, I'd like to do a televisit. And the message I get back is, call the office so we can talk about converting it into a televisit. So this is how broken this whole experience is. And I feel like healthcare organizations, for the most part, do not even get it. And so there's a long, long way to go to really create the kind of digital experiences that the Amazons of the world have perfected. Amazon, Apple, take your pick. So the challenges are going to be cultural, first and foremost, is what I'm trying to say here. Unless healthcare organizations fully and completely submit to the idea that a lot of their interaction with their patients is going to be online from the get-go, and they have to organize themselves, reorganize their processes, invest in the technology, redesign their workflows, and make it easy for consumers to gain access to care. I go back to access because access is where the battleground is from a competitive standpoint, especially in the primary care market. Unless they do that, they're going to struggle. And I think it'll then lead to all the other challenges related to the digital transformation, which is purely cultural. The tech is easy, even though I work in tech. The tech, quite frankly, is easy. There's plenty of tech. It's what you do with it and whether you can get people to adopt the tech. Most of the work that I do, my firm does, in our advisory work with health systems, bumps up against this question again and again. Sure, we can invest the few million or whatever it is we need on the tech. How do we increase the adoption rate from our patients as well as from our caregivers? And that's the struggle I think most organizations are going to have to overcome.
Yeah, culture eats strategy every day for lunch. Well, listen, I want to continue this conversation, but first, I just think it's important to check in with the audience and see what their experience, whoops, sorry about that, their experience is in doing digital transformation. So if each of you could just go into the box that should come up in a second and just answer the following question. Where is your organization currently in digital transformation? Either it's not a business priority, you're not sure where to start, you're in the planning stages, you're working on it, or you're deploying now or piloting. Notice we didn't give you an option of we're fully digitalized or fully transformed, because it's a journey. But while we're waiting for that poll to come up and get the answers to that poll, Craig, Patty brought up this issue of culture, but it's also business model, I think, too. Wouldn't you need a different business model? And are people struggling? Is that a barrier in addition to the tech and the culture?
Oh, I think for sure. For many providers, first of all, they're in fee-for-service and value-based care, and they're completely upside down from each other, and what decisions you make and run in the business for fee-for-service are completely different for value-based care, staffing, investments, target segments, how you work with, the delivery system. So I think that's one problem right off the top in a business model. One of your earlier slides mentioned, the investment in technology change, process change, change management, and it's a long haul. And, if you're already under pressure, it's sometimes hard to say, well, I'm sure this will pay off in 3 years or 5 years, when I'm through the transformation. So, and I think that's where sometimes you see, a lot of payers, for example, trying to support providers' transformation to value-based care, not necessarily digital, but to value-based care. So I think that's a big deal. And, one thing I would just add to Patty's comments on the prior question is, I think a lot of organizations tend to have digital be the headline strategy, where I really think consumerism is the headline strategy. And that's mindset, culture, process design, and then digital is a critical success factor underneath that consumerism strategy, because otherwise you don't see it. And I see a lot of times where, a company has a digital strategy and then they try to reframe it in terms of customer experience, and the initiative is led by IT. And so you can see the organization seeing this as a technology, deployment, installation, data management kind of thing, which is of course true, but they're not seeing it and engaging the broader leadership team in what really has to happen if you're going to, fulfill the journey and the promise that consumerism can bring.
That makes a lot of sense. Well, let's see what the audience says. Let's go ahead and pull up the poll results. Take a look at that. Wow, looks like maybe people are transforming. What do you think, Patty?
Well, I'm looking at the one that had the most responses. We are piloting / deploying. I'm assuming that they're talking about a technology. The ones that concerns me is that it's not a current business priority for us. I don't know what to make of that. We're in the planning stages. We're not sure where to start. We hear variations of this when we talk to our clients, which is why and I'll talk about this a little bit later on as well. It's important for healthcare organizations to have a good sense of where they are in their digital maturity and compare, benchmark themselves against their peers in the marketplace, especially if you're in a very competitive marketplace. Any of the big cities, David, you're in San Francisco, competitive marketplace, New York, Boston, any number of other markets that are very competitive. You really have to get a very good sense of what your consumers, what your populations are expecting, and how your competitors are delivering on those expectations. So whether you're in planning stages, whether you don't know where to start, whether you're in pilot, in isolation, it may not mean a whole lot, but in the context of what's going on in your market, it could mean the difference between long-term survival or not. And so I would say, as long as as long as you recognize that there is a need to transform and you've taken your early steps, you're on the right track, at a very, very broad level. But you got to dig a little bit deeper and see where, are you further ahead of or behind or on par with your competitive marketplace? I think that becomes the important question.
No, that makes a lot of sense. And, there's just so much here to talk about as we face this. And I agree. I think people need to kind of get their arms around what the future will look like and start heading in that journey. Patty, you first started off when we started this webinar talking about the idea of the life cycle, the patient life cycle. Craig, we talk a lot about this now. What's the patient journey? Do you think there's a need to reimagine what the patient journey is as we think about this transformation in healthcare?
Well, I don't mean to come across as negative, but I think many people anyway in our industry would agree that the current patient journey, however you define that, is not a good one. And, there's not high levels of satisfaction or efficiency or outcomes really at all. And so to me, that would suggest, you need to reimagine it. And there's so many factors, that go into that. But, the current journeys give us the current results, which are lousy as a system. There's great outcomes and great miracles and, lots of good as well. But I would say in generally, if you get sick, you're off into the abyss of the system. And it's a pretty lousy experience for most, at least for many people in many places.
Yeah. And then, on top of all of that, and I think the pandemic has illustrated this for many people, so we also talk about this issue of it's not just the experience for health and recovery and treatment in the health system, but there's these social, economic, and environmental impacts as well. Patty, how do you think about these concepts? And one of the terms that we've heard come up, I know here in California, Medicaid is going through a waiver process of talking about whole person care for health. How do we think about this? How do you think about this in your organization?
Yeah, if I look at if I kind of pick it up from the previous slide where you talked about the need to reimagine patient journeys, at the risk of stating the obvious, the pandemic has created fundamental changes in the way consumers or all of us as individuals relate to our work and our environment at large. We are a lot more remote in the way we do things, including in healthcare. Now, in healthcare, the acceleration of the virtualization of care is one of the big outcomes or the consequences of having to deal with the pandemic. Now, the way you reimagine care in this context is by using technology to continue to deliver care and deliver access to care in a remote/virtual care model. And we had, Craig made several comments about this, and David, you made several comments about this as well. But then when you talk about individual populations for individual health systems or in individual markets, the need to look at the individual's needs become paramount, because you talked about Medicaid as an example. If you're in a predominantly Medicaid population as a health system, the way you imagine your patient experience is going to be very different from if you're in a market where you have a predominantly urban, millennial, well-to-do population. And it drives all kinds of decisions, from how do you provide access to care to a population that may not have, the current generation of smartphone devices, maybe living in bandwidth deserts, maybe in rural areas, maybe in, inner city environments, and where you really have to make sense of their needs through a combination of their socioeconomic environment that they are in, as well as the need to keep them out of the hospital, need to meet their healthcare needs at the same time. So I think the notion of whole person care is absolutely spot on. the nuances arise when you're looking at individual population segments in your particular markets. And that's where you start thinking about how you make use of the data, the technology, and all of the other enablers that are available to you.
So this is interesting because both of you have now said that technology is an enabler as opposed to a solution. So as we think about that, how can providers start to think about what are the things they might need to do to really enable that transformation? Greg, let's start with you.
Well, I think the first thing is the foundation. And even though we've talked, I've kind of made my comments more around the process and people side of it, you do need some basics in place, like your data, like integration of your systems, because otherwise you can't do it and you have to stop. It just, you don't have the foundation. Beyond that, I think for many providers, they need to partner. This is not their core business, and they need to, look for companies that can help them think it through and execute it, because they're busy, and they're taking care of patients. They're not a big insurance company with lots of resources, for these kinds of things, or a startup with a lot of private equity money or something like that. So I think they need help. And to your earlier point on the business model, I think they have to figure out a way that, that supports their business along the way. They don't have the luxury of, let's invest and work on this for 3 years, 5 years. And in the end, we'll flip the switch here and we'll start getting value from it. So it's a very heady to talk about the roadmap topic, because most times people think of a roadmap as a series of technology releases, as opposed to a business roadmap, because you have to figure that out. Somewhere there's a CFO, looking at the realities of the world, and somewhere there's an operator that's, trying to keep the lights on and make things work. So I think you have to, put these kinds of things that are classic, content specific steps into the business environment. And that cross section to me is where, the strategy gets important and hard.
Patty?
I would say, providers first and foremost have to embrace the notion of a digitally enabled care model. And I go back to my earlier comments about culture, because, digital transformation is not just about patients and consumers. It is also about the caregivers. It's also about the providers who are delivering the care. And I often like to say that we cannot improve or enhance the consumer/patient experience at the expense of the physician experience. Physicians also have to feel as though they are invested in, enabling the experience through digital tools. And so it's really important to get physicians, providers on board, because, to Craig's earlier comments, provider burnout, they just don't want one more tool to deal with. On the one hand, they also don't want to have to deal with a lot of different systems that, create a lot of friction and slow them down in their day-to-day schedules. However, there is a way to make this all work that can improve their productivity, can help them deliver better care, and effectively, improve the financial health of the organization as well. So providers need to firstly embrace the notion that in future a lot of care is going to be delivered in a virtual/digital model. And once they come to terms with that shift in mindset, I think a lot of things will open up really quickly.
Yeah, and I think, we could do a whole hour, if not a whole day, just on this issue of, how to get the culture of physicians to really change. A couple comments that came in on the queue about, moving to virtual is, what if I miss something? What am I responsible for if I miss something? I'm used to seeing patients face to face, right? make a misdiagnosis or whatnot. So this is just, it's going to be tough. I remember my father, and he's 92 in his primary care. He says, my doctor doesn't talk to me anymore because he's always busy typing on the computer when I'm with him. So we have to figure this out, I think. But let's turn to the consumer again. So when we think about reimagining the consumer's digital experience and the patient journey, how can we break this down? What are the different things we need to think about, the components? Craig, let's start with you.
Well, I think this is an interesting question that ties back a little bit to how would a provider get started, because back on the poll where some people were, it's not a priority, we haven't started. This can be an intimidating topic, and I've got a saying, at least for a startup, the most important thing is to start. And so one place is, are there some easier wins? So let's take, for example, something as simple as customer service. And if you look at some of the things that from research that drives why a patient would switch primary care doctors, it's access, how long for the appointment, and then how long do I have to wait in the waiting room? It's things like, how many times do I have to fill out this paper? And things like that. So maybe, depending on your situation, you start with, hey, I'm going to do a great job on the administrative side. I'm going to welcome my patients. I'm going to get them information. I'm going to make their experience more convenient, more friendly, more online, for them. The second thing is, I'm a big believer, if you can make it easier for the provider, that will make a much better experience for the patient. Not to mention that there'll be actually a provider to see, and all those kinds of things. So, things like referral management and retention and things like that, I think you got to look at it and say, are these things really part of the future anyway? And are they adding value? If you're in a value-based care environment, at least in the traditional sense of a payer program, is that where you want to put your effort in some of these, kind of old style cost management programs? And then in the outreach and targeting, I think that's another great topic, because the first thing a provider has to do is acquire a customer, and build a relationship with them, which I think is really a great opportunity for a digital channel is to build a kind of an ongoing relationship with the consumer, as opposed to thinking about it as I can automate a transaction and save money but build a relationship. Because if you don't have the relationship when you need them to come in or engage or adhere, you're going to have a much harder time than if you have a great relationship. So, in the end, I think it goes back to the core point Patty has made. If your culture is one of consumer first, then these things come a little more natural. And if it's provider first or financial first or capability first, you probably never get there.
Patty, a lot of different components here. How do we pull it all together for the patient?
Yeah, I think Craig made a very important comment, which is, you got to pick your battles, right? Pick the areas where you can make a difference. And from his comments, it's clear that access is the area where you can actually make a difference. Do it in a way that delivers real value, while at the same time not, taking on too much risk to patient care and outcomes. So administrative processes, simple things like self-scheduling. If you can enable that and make life easier for patients to schedule their appointments and reduce the burden on administrators, then you've got, you're already on your way to digital transformation. I think, I'll mention a couple of things here. We recently completed an engagement with one of our clients where we conducted an internal survey to ask, what are the top priorities for a digital transformation roadmap? And the number one priority that they came up with was being able to provide patients with tools to navigate their access to care within the health system. And we're talking about a large, complex health system. There are multiple ways to access it. You got the 1-800 number, you got the website, you got the, all the other stuff. And often it's challenging for somebody to really get through to the people they want to talk to or to get an appointment with. just by providing them with tools online to enable them to do what they need to do, and just serving up the tools, whether it's a find a doctor tool or whether it's a scheduling tool that syncs up with some kind of a calendar and so on and so forth. There's many examples of how you can enable that. So take the easy ones where you can have a big impact with a relatively small amount of risk and a relatively small amount of investment as well. What I would also say is a lot of the instances where people lose faith in digital modes are when people take on things that are too complex to take on right away. So for instance, you don't want to tell a doctor, an oncologist, that they should start thinking about taking care of their cancer patients through a virtual model. It may not be the right example to begin with, but behavioral health, maybe, yeah. And you're going to get much more buy-in for sense. So you have to really parse through your opportunity landscape, pick the right ones, show wins, and then build on that momentum.
Now, those are great comments. And, I drew this picture out of a patient journey, and it's in different colors because you can think about, to your point, Patty, it really depends on the culture of the organization, the patients that are served, where you're at in developing some of these services. And, I think one way to think about it is, which of these things do you start in? Do you start about your outreach and how do you engage people digitally? How do you make appointments? As I think you were saying, you're able to schedule your appointment online, but not get a video. So it's a nice bump. You can actually start to have video services if you're that organization, if they're online, it can take that. But there's also, you get referred to a specialist, and then what if you have a disease, or what if you're scheduled for heart surgery, and care managers are involved. So there's other people in the ecosystem. And how is that journey different than, I think, Craig, you pointed out, filling out paper, pencil, person never saw you before when you get a referral? Or it's so
this is where I think, data-enabled approach and a technology, combination of an advanced technology combined with a better understanding of a patient's medical history, and the surrounding elements of an individual's life and work and so on can make a big difference, right? If you've got you talked about referring to specialists. So somebody needs to be referred to an expert cardiologist because that individual needs to have some kind of a procedure scheduled in the short term. Well, when that individual calls in and gets a call center agent on the line, the agent has to be able to quickly pull up the information about the individual and be able to refer that individual to the cardiologist, schedule the appointment at the earliest available opportunity. But the cardiologist also needs to have all that medical information pulled up, and possibly with some additional insights about propensities for risk, the medications they're on, comorbidities, all the other good stuff. And this is where the data foundation becomes more and more of a powerful enabler. So you got the data, you got the analytics on top of it, you got the workflow and the experiences at the front end. It can be a powerful combination if you can get it right.
Let's check in with our audience, because those are great and complex issues you're bringing up. Let's see what they see as their primary roadblock to achieving digital transformation. Is it the cost of these new technologies? Is it the resistance, the cultural resistance from providers? Is it the lack of strong data protection, or the sense that it's not safe? Concerns about other things as well. So as people are answering this poll, I'd like to continue this conversation and start to get into how we get there. So we'll check in with the audience poll in just a second. But it really is, Patty, to your point, you said it's about data, right? The data to be actually support that journey. Craig, is that your perspective as well? And what's your experience?
Well, absolutely. Unfortunately, this is, a tough issue for a lot of companies because of their situation with the siloed data all over the place, all the data quality issues, even knowing if the John Smith from this system is the same John Smith from that system, just identity resolution and all those kinds of things. Because in a lot of ways, all the use cases we've talked about for that digital can enable, start with good data and integrated data and analytics that sit on top of that. And you can't have analytics unless you have good data and good data models. So it kind of builds up. And so that's where for a lot of people, I think it's a daunting task because, you know, people are in these big legacy companies, you know, that have old claim systems and old databases and old technologies that don't play well together with the new world, you know, and maybe they don't have all the skill sets in house to get there. So I think you've almost got to think about it in a couple of ways at the same time. One is, hey, I got to tackle the data problem, period. Two, where can I make progress and create some value? Because I can't wait 2 years for a big data project. And are there pockets where the data is sufficient and good enough that I can, you know, drive some value for a particular process? But you know, everybody's got the data problem.
Yeah, absolutely. Well, let's pull up and see what the audience thinks in terms of their challenges. And I saw a comment in the chat about it's going to be more like waves and a linear journey because it has to be very customized. We couldn't do that on a picture. Oh, this is interesting. Kind of like we're all over the place. Patty, I kind of want you to comment on these responses and do it in the context of the way you think about this at Damo Intel.
Yeah, so primary roadblock to achieving digital transformation in healthcare, you know, I'm not surprised that the maximum number of responses has come for the last option here, which is siloed data scattered across multiple systems. And I tend to agree with that. I think if you're really not able to get a comprehensive, unified view of your patients in real time in order to be able to deliver the kind of care and experience that they need, no matter how cool and slick your user interface may be, it's not going to work that well. And that is the fundamental difference between the industry sectors that are much further ahead on their patient experiences, like e-commerce or personal banking or, you know, financial securities, hospitality, and go on and on. I think that is a fundamental challenge. Now, interoperability is a work in progress, and I've been around long enough to know that it's come a long way in the last several years through a combination of marketplace mechanics, through consumer pull, a regulatory push, combination of other things. But there's still unfinished business in interoperability and the issue of siloed data. So I will definitely accept that as a big one. When I look at the other items, perceived cost and complexity of new technologies, that is an interesting one as well. I think one of the comments that I hear often is that technology-enabled care, paradoxically, may actually increase the cost of care. Because if you slap on technology without really getting the efficiencies and the productivity gains out of it, and you spend more managing the technology than in managing the outcomes or managing the experiences, it is very, very conceivable that, you know, the cost and complexity of buying, integrating, deploying, and working with new technologies can become prohibitive. And I do see some technologies bumping up against that conundrum as well. So those would be my two comments. You know, in the context of how we look at it in our organization, we look at a three-phased strategy model. And with one of the first things we recommend to our clients is to do a digital maturity assessment. Where exactly are you in your digital maturity relative to where you want to be and relative to where you are in the market? And the answer to your current situation may not be that you accelerate your digital transformation and you try to do everything that, you know, the leading providers in the land are doing. That may or may not be your answer. And so you really have to be thoughtful. And we have a 4-stage maturity model that, you know, supported by a numerical model and so on and so forth. And the other thing we do is pick your partners correctly, right? Cannot afford to make mistakes, because the cost of a technology mistake is not just in the sunk cost of the technology, it is an opportunity cost in the marketplace. And those costs can be much, much higher. So we, you know, our Damo Intel platform, again, not trying to plug it here or anything, but you really want to make an informed decision about who you want to partner with, do your due diligence upfront, but also do it quickly, because the marketplace is not going to wait for you. So those are the two things that I would mention in that context.
Well, Patty, this is a very detailed a view of sort of how you can really help someone through that by creating a framework for thinking about it. And I think I'd urge everybody to go read your book, which I see a nice picture here. So we'll supply these slides, but I think there's more in the book that I think that the audience can achieve as well. So this is awesome. Craig, at Lucerna Health, you've thought about this, and I think you've got similar thinking about technology, but you've created a platform, right, for customers like Sanitas.
Well, this is this Sanitas platform. You know, Sanitas is a primary care practice across the U.S. And you know, this is let's call it phase one of the digital front door. And I think we put this in here just to illustrate a couple points, not to go through each element here, but the first, and it ties a little bit to how you can think about a roadmap. The first thing is bring everything you have spread around together, integrate it, and have a nice user experience. So, you know, first, make what you have work better for a consumer on a digital platform. The second thing is over here on the right, how do you think about plugging in and integrating your online experience with your offline experience, your call centers, your care coordinators, your primary care physicians, your specialists, because they do intersect. And if you think about really a consumer experience, you can't stop at the digital and then say, okay, now let's start over, and you're going to have a completely different experience in person. You want the experience to cover this whole page, online and offline, and all the major components that you think you can execute on and that will deliver value for patients or your providers. And then what's not on the page is, let's call it release 2 of ecosystem integration. So Sanitas does a lot of deep integration with payers because the belief there is the deeper we're coordinated and integrated, the more time we can spend creating value versus managing complexity. And that's where a lot of these problems come in, like you're adding costs. Well, yeah, because you're adding complexity. So you need to figure that out. But imagine if this data and digital enabled experience includes online, offline, and payer and provider and specialists, let's say. And so when you're sick, you got to deal with your provider who's telling you one thing, your payer's telling you another thing. You got a portal over here and a password over there, and what do you do with that? That's not a recipe for success. So this is a digital front door view of how you start to pull together at the provider level, and then at the provider and payer level together in one basically app and experience.
And that makes sense. And my familiarity working with you, Craig, and Lucerna Health and Sanitas. Sanitas is a partnership with the Blue Cross plan, and I think they only see that Blue Cross plan, Florida Blue, I believe, in Florida and in the other states as well. But so that provides that kind of alignment. A question I have for Patty, and this came up in the chat here as we think about the questions the audience has, is how do we think about getting payer provider alignment outside of the direct alignment that we see with Lucerna and with Blue Cross?
I think one of the big opportunity areas for payer provider alignment is in the data. And if you can actually combine the longitudinal medical records of the patient that sit with providers with the claim records that sit with patients, you can potentially get a comprehensive view of the patient that enriches your understanding of your patient/member in a way that you couldn't do it just with medical records alone or with claim data alone. In fact, we work with a client who happens to be both, both a payer and a provider. Very interesting to see how they are, they approach the data. Of course, there are guardrails around what you can do with, member data in the context of, treating providers, or especially, if you've got other, providers that are in your network and so on and so forth. But setting that aside, at least for members who happen to be your patients as well. If you're if you're a health plan and a health system, there are things you can do by combining the data that help manage, from a whole person care standpoint that David, you mentioned. That's why, but you don't have to be a payer and a provider in the same organization. There are examples of large providers that are coming together to form JVs or some kind of arrangements. An example that comes to mind is Christiana Care, that's partnered with, I believe, is Highmark, if I'm not mistaken. The whole intent there is to really create this data set that can enrich your view of the patient/member. And by managing the outcomes, managing the population better, you can get some benefits that you get to share. So that I see as an obvious advantage. There are also, I will say that, there are some redundancies also that I see when I look at payers and providers. Digital engagement, for instance, the same kind of things that my provider wants to engage with me on is, the same thing that the payer wants to engage with me on as well. So who do I pick? And, so there's some fragmentation as well that I think needs to be addressed.
No, that makes sense. And I think both of you are familiar with the way we think about it here at Innovacer. I mean, we're a data company. Craig, you pointed out these data silos. It's bringing together all of these kinds of data you see here on the left, the EMR data. Sometimes talking to somebody yesterday, they have 81 different EMRs in their network, their clinically integrated network. 81 claims data, it's a very different set. And sometimes those folks are working on a different set of data than the provider, to both of your points. The social determinant of health data, that opens the door for a lot and lots of other form. But how do you then make sense of harmonizing that data and then activating it into the workflow of all the different people involved? So the patient has a good digital experience in their journey through this. And then how do you allow innovation? How people develop their new applications, new workflows? In fact, that's why we named the company Innovacer. How do you accelerate innovation? So this has been a great conversation. I want to open up, there's a few other questions here. I think we have a few minutes. So one in the audience brought up that meaningful use and meaningful use too was supposed to be the driving factor, right, toward this new digital environment. But we haven't quite got that right yet, have we? And then this payer provider working together toward a better goal, that was supposed to be the data integration goal. So Craig, in closing comments, what do you think what the solution is for America today around tackling these problems?
Yeah, I think all those things have helped move the ball down the field a bit. But in the end, it's going to be the private sector executing. And I would leave with two thoughts real quick from my piece. One is get started. And I like to use the phrase walk the talk. If your company's talking about consumerism or digital transformation, do it, get going. And then in the how, I used to say, hey, we can't fix the system, but we can fix it for you. And the idea was to find pockets of consumers or patients where you can, in fact, make the experience and the outcomes better. And maybe think about it that way and not try to, tackle everything all at once.
Patty, your thoughts?
I think, we've covered a lot of really interesting points as part of this conversation. I would echo Craig's comment that, you have to get started. If you haven't started, you're already too late. You have to start somewhere. Pick the one or two things that matter the most to your patient populations, to your consumers, your constituents, and make an investment and build on the successes. Demonstrate the successes. It's important to demonstrate the benefits of whatever investments you're making. Educate yourself about what is going on in your marketplace. Talk to your peers, how they're going about it. If you're a part of some organization like HIMSS or Chime, take advantage of all of the opportunities to really see what your peers and other health systems are doing, and there's a lot of education in there. And pick your focus areas and commit yourself to it and move forward.
This has been a great conversation, and those are great words of advice from both of you. So I think in closing, I just want to say thank you all for bringing this all together. Thank you all for bearing with us as we're learning Zoom for the first time. We've used a different platform in the past, and I think this has been successful. We will send a copy of the slide deck out and information about the organizations you've heard about today. If you want to know more, you can also reach out to us and team@acer.com. But I want to thank the audience first and foremost, but for our panelists, Patty, thank you so much for coming. This has been great, Patty.
Thank you so much.
And Craig, same for you. Thanks again. This has been great insights from Sanitas Lucerna Health, combination. So thanks.
Great,
Craig.
enjoyed it. Thank you.
Thank you very much.
Great. And thanks once again to the audience. Appreciate it.